Hypernatremia. What is it? Hypernatremia is a very long word, and I'm sure it sounds scary, but it's a condition of having too much salt in the blood, or sodium. And while sodium, like other things, is good in small amounts, in big amounts it can cause huge issues. What causes it? So, as stated previously, increased levels of sodium cause it, but the most common causes are medication and meals. Other causes that increase the risk for hypernatremia is old age and high-intensity sports or activities, basically just because they drained the body of the water that it needs through sweat. So to the side we have a mnemonic just to help you remember the top causes of hypernatremia. Signs and symptoms. Some of the more common ones are confusion, fatigue, seizures, fever, dry mouth, and low urinary output. To the side there's also 2 different mnemonics to help you remember a few of those as well. How is it diagnosed and treated? So it's most commonly diagnosed through blood and urine tests just because they're less intrusive and they're very convenient for the patient and doctor, and also very fast. In mild cases, it's just a matter of telling a patient to drink more water. But in more severe cases, it may have an IV fluid, or, as we'll learn about later, it can cause brain bleeding as well, so surgery will have to be done to correct that. So some common questions. What happens if it goes untreated? So if it isn't treated, it can lead to confusion, muscle twitching, bleeding in the brain, and in extreme cases, death. Do people have a predisposition to it? Yes, there are some genetic influences, medical conditions, and everybody's body is different, so some individual kidney makeups are just unfortunately at a higher risk of having it. And it can be prevented by drinking water in moderation while also ensuring an adequate level of water in the blood, which basically means don't go out drinking 2 gallons of water a day, but also keeping the recommended 8 glasses of water in your body, as well as drinking more if you're taking in increased amounts of sodium, or just putting a limit on your sodium intake. And thank you for watching.